Ketone bodies are water-soluble molecules produced predominantly in the liver. The principal ketone bodies are acetoacetate, beta-hydroxybutyrate, and acetone. Acetoacetate and beta-hydroxybutyrate are useful ketone bodies which are used for energy production. Acetone, on the other hand, is a waste product, which is excreted by the lungs. Exactly, acetone is responsible for the sweet odor in patients with ketoacidosis. The main question is that what makes ketone bodies so essential for our metabolism? The concept is that, unlike most other tissues, our brain cannot utilize fatty acids for energy production, and this creates a huge problem in a state of glucose deficiency. Because if there is no glucose, what brain should use to produce energy? And exactly in this case, ketone bodies becomes the essential source of energy for our brain. In fact, approximately 2/3 of the brain energy needs during the periods of prolonged fasting are covered by ketone bodies. They are present in small amount even in normal condition, but if their level significantly increases and ketoacidosis develops, in these circumstances they become a problem. The most common conditions that can cause rise in ketone bodies level are diabetic ketoacidosis, alcoholic ketoacidosis, and salicylate poisoning. Below you can see the pathway of ketone bodies in our organism, and at first glance it looks quite complicated. So let's discuss their pathway step by step, and maybe it will be easier for us. Initially, we will discuss how ketone bodies are produced. So, in our blood we have glucose, which is the most valuable source of energy in our organism. Practically every cell in our body uses glucose as source of energy. But what happens in conditions as fasting or with decrease in carbohydrates intake? Because in these circumstances blood glucose level decreases. So how organism fixes the problem? During fasting or when carbohydrate intake is severely restricted, blood glucose level drops. The body senses this decrease in glucose and reduces insulin secretion while increasing glucagon secretion. In our body we have adipose tissue, which consists mostly of triacylglycerols. Proglucagon state activate lipolysis through activation of hormone-sensitive lipase. As a result of breakdown of triacylglycerols, massive amount of free fatty acids released into the bloodstream. In the blood, free fatty acids bind to albumin, and in form of albumin complexes, they are delivered to liver tissue. In the liver, free fatty acids undergo beta oxidation. This process takes place in the mitochondria. Beta oxidation of fatty acids results in production of large quantities of acetyl-CoA. After this, most of acetyl-CoA molecules go into the Krebs cycle. And important that the activity of the Krebs cycle depends on the amount of its intermediate metabolites, and one of those metabolites is oxaloacetate. And the amount of oxaloacetate is proportionate to the amount of glucose in the tissue. So guess what? During fasting, for example, glucose level decreases, which causes decrease in oxaloacetate level. And with decrease in oxaloacetate, the function of the Krebs cycle decreases. So now, liver cannot use all of these acetyl-CoA molecules in the Krebs cycle. Acetyl-CoA begin to accumulate, and we have to find the alternative pathway. And it's the moment when liver begins to produce ketone bodies. Initially, from acetyl-CoA, liver produces acetoacetyl-CoA. After this, a specific rate-limiting enzyme called HMG-CoA synthase converts acetoacetyl-CoA to HMG-CoA. The activity of this enzyme dramatically increases during fasting and starvation. From HMJK, liver produces acetoacetate, which is the first ketone barrier. From acetoacetate, we can produce beta-hydroxybutyrate, or by decarboxylation, we can produce acetone. So it's the pathway how from fat tissue we can produce ketone bodies. We consider ketone bodies a fat-derived energy, and it's a valuable source of energy because even after overnight fast, ketone bodies supply 2 to 6% of the body energy requirements, and in 3-day fasting, they can cover 30 to 40% of energy demands, which is huge. Now, this oxaloacetate regulation of the Krebs cycle and thereby of ketone bodies formation is a big deal on examination. So let's cover this one more time. So we have acetyl-K, and by binding of acetyl-K to oxaloacetate, we can use acetyl-K in the Krebs cycle. Oxaloacetate we form from pyruvate, and pyruvate we produce from the glycolysis, which is the process of glucose breakdown. But in states when the glucose level is low, we need to produce glucose. So now we do not use pyruvate to produce oxaloacetate. Instead, we use oxaloacetate to produce pyruvate, from which we can produce glucose in a process called gluconeogenesis. As a result, the amount of oxaloacetate decreases, and thereby the activity of the Krebs cycle decreases. And if we do not burn acetyl-K in the Krebs cycle, we use acetyl-K to produce ketone bodies. Hope it makes sense. Liver has enormous capacity to produce ketone bodies, and the major advantage of ketone bodies is their chemical properties. They are short-chain organic acids that can freely diffuse across cellular membranes, which means they can diffuse through the blood-brain barrier, and thereby they can be energy source for neurons. So now, let's explain the clinical significance of ketone bodies. As we already know, ketone bodies are produced in the liver. It's acetone, beta-hydroxybutyrate, and acetoacetate. And important that liver can only produce ketone bodies. It cannot utilize them. We'll see why. Once ketone bodies are produced, all of them enter into the blood. In the blood, they can circulate freely without any transporter. Among all ketone bodies, there is just one which we can consider trash. It's acetone. Totally useless ketone body which goes into the lungs, where we excrete acetone with breath. Exactly this molecule is responsible for the fruity odor in ketoacidosis. At the same time, beta-hydroxybutyrate and acetoacetate go to the extrahepatic tissues, as muscles, brain, myocardium, etc. In these tissues, initially, we convert beta-hydroxybutyrate to acetoacetate. After this, a crucial enzyme called succinyl-K transferase, also called teolase, converts acetoacetate to acetoacetyl-K. Without this enzyme, tissues cannot utilize ketone bodies for energy production. After this, acetoacetyl-K undergo conversion to acetyl-K, which we metabolize in the Krebs cycle for energy production. But why we pay so much attention to teolase? The reason is that liver tissue do not have teolase, and because of this, liver cannot use ketone bodies. It can just produce them. The concentration of ketone bodies can vary in huge margins, but important that we have so-called physiological ketosis. In neonates or during pregnancy, increase in ketone bodies in some cases can be physiological. For example, in infants, increase in ketone bodies concentration caused by high fat content of milk. In addition to this, mild infections, especially those associated with vomiting and diarrhea, can provoke increase in ketone bodies concentration. Pregnancy, for example, is associated with 2 to 3 times elevation of maternal ketone bodies level at baseline. The problem is when concentration of ketone bodies becomes huge, and in this case it can cause fetal malformations, including neural tube defects. Ketogenic diet and prolonged exercises can also cause physiological ketosis. But let's explain why ketone bodies can be dangerous. Let's assume that the concentration of ketone bodies becomes huge. What will be the consequences? First of all, increase in ketone bodies cause decrease in blood pH, because all of them are organic acids. To compensate increase in organic acids, we begin to use bicarbonate as a buffer system, which leads to decrease in bicarbonate level. As a result, a condition known as metabolic acidosis develops. Increase in organic acids also causes increase in anion gap, which is an important diagnostic feature. In addition to this, decrease in blood pH activate chemoreceptors, and activation of chemoreceptors cause abdominal pain, nausea, and vomiting. Ketone bodies are excreted with the urine, especially acetoacetate. But with increase in ketone bodies in the blood, their concentration in the urine increase, which markedly increase urine osmolarity, and in turn, this leads to increase in osmotic diuresis, a condition known as polyuria. To compensate loss of fluid with the urine, we try to increase water consumption, which leads to polydipsia. Also, acidosis caused by ketone bodies cause shift of potassium out of the cells. As a result, total body potassium depletion develops. So a person can even have normal potassium level in the serum, but inside the cells, potassium level will be low. In addition to this, to somehow normalize blood pH, organism increases respiratory rate. This symptom we call Kussmaul respiration. But ketone bodies have also beneficial effect. They are neuroprotective substances because they decrease excitatory neurotransmitters, which can help us to control seizures in patients with epilepsy. So keto diet is one of the therapeutic options in epileptic patients. So let's summarize. We have 3 ketone bodies. In order to begin ketogenesis, the level of oxaloacetate should decrease, which happens in low glucose states. We can determine acetoacetate in the urine, which can help us in diagnosis. Also, one of the cells that cannot use ketone bodies are red blood cells. They use just glucose. And liver also cannot use them because it lacks teolase. So it was the general concept of ketone bodies metabolism. Thanks for watching.